Hello, this is a web tutorial on pain management after carpal tunnel release surgery. The goals of this video are to set expectations for pain post-op for carpal tunnel release surgery, to explain what we know about pain management using opioids versus non-opioids for carpal tunnel release surgery, to explain what we know about the risk for prolonged opioid use post-op for carpal tunnel release surgery, and to go over our general recommendations for pain management. Let's start with setting expectations for pain post-op for carpal tunnel release surgery. In the short term, you may still experience numbness and pain as a byproduct of the surgery, and this can last for up to 3 months. Many patients also experience pain and irritation at the site of the incision, and this is a result of it healing. The big thing to look out for is that as time passes, your pain should decrease. And along your healing journey, if there's a sudden increase in your pain, this is a red flag and a reason to contact your doctor. In the long term, 90% of patients experience relief from carpal tunnel release surgery. And generally speaking, patients with more severe symptoms tend to experience more improvement. So if you are someone who has very severe symptoms, you should expect a pretty dramatic drop in your symptoms and greater functionality. But if you are someone who doesn't have as severe symptoms, you may not experience as dramatic of an improvement. Now let's go over what we know about pain management using opioids versus non-opioids for carpal tunnel release surgery. And the reason why we want to talk about this is that in general, surgeons prescribe 2 to 5 times more opioids than patients consume. And over the last 20 years, there has been a steady increase in the number of overdose-related deaths involving opioids. And we, of course, want to minimize the risk for opioid-related deaths. With that in mind, let's look at how well opioids versus non-opioids improve pain after carpal tunnel release surgery. So on this graph, this is looking at the average worst daily pain post-operatively days 0 through 5. On the y-axis, we have pain experience with a higher score indicating more pain and a lower score indicating less pain. Looking at our groups, endo stands for an endoscopic surgery, oxy stands for opioid, open stands for an open surgery, IBU stands for ibuprofen, and ACE stands for acetaminophen. And as you can see here, across these groups, they have about the same pain experienced. And if anything, the opioid group experienced more pain. When we look at this over time, we see a similar trend. On these graphs, the green group is the ibuprofen group, and the blue line indicates the opioid group. So here we can see, again, on our y-axis, this is a pain scale with a higher score indicating more pain and a lower score indicating less pain. And generally speaking, over time, the ibuprofen group had less pain than the opioid group. Similarly, if we look at pain relief, with pain relief on this graph being a higher score and less pain relief being a lower score, we see that the ibuprofen group, generally speaking, had more pain relief than the opioid group. Now I want to talk about what we know about the risk of prolonged opioid use post-op for carpal tunnel release surgery. So on these graphs, if a score is greater than 1, that indicates an increased risk, and a score less than 1 indicates a decreased risk. We can see here that patients who have an elective surgery have an increased risk of prolonged opioid use relative to patients who have a trauma-related surgery. When we look at comorbidity index, we see that patients with a higher comorbidity index have a stepwise increase in risk relative to patients who do not have a high comorbidity index. And a comorbidity index is just a measure of chronic diseases such as heart disease, diabetes, or kidney diseases. So the more chronic diseases one has, the higher the comorbidity score. We also see that patients who use tobacco have an increased risk of prolonged opioid use relative to patients who do not use tobacco products. We also see that there's some variables that do not seem to increase or decrease the risk of prolonged opioid use. And these include age, gender, alcohol dependence, and history of pain. And while these statistics do provide good general guiding principles, you are an individual, not a statistic. Just because, according to these statistics, you have a low risk, it does not mean there's absolutely no risk associated with prolonged opioid use. Likewise, just because these statistics say you have a high risk, it does not guarantee that you will have prolonged opioid use. You are the expert in you, and we are the experts in opioid use, pain management, and carpal tunnel release surgery. And we really want to bring our expertises together to design and come up with the best pain management plan for you. With that in mind, I want to now go over what our recommendations are. And to start off, I want to define what our goal is. Pain-free is not our goal here. By nature of the fact that you just had a surgery, there is going to be some pain associated with this procedure. And really what we are aiming for is pain relief, which is minimizing the amount of pain you experience. With that in mind, our first recommendation is to try a non-opioid medication first. If you experience adequate pain relief, continue to take that non-opioid medication. If you do not experience adequate pain relief, you can take opioids, but take as few as possible to get pain relief. Once your pain becomes bearable, stop taking the opioid. And lastly, we recommend talking to your doctor about your pain management plan if your symptoms are not improving or you have a history of opioid addiction. Thank you for watching this video. We hope that you found it helpful. We kindly request that you fill out the feedback survey that is found in the description so that we can improve this web tutorial. Please contact your doctor with any specific questions related to your unique pain management.